back to you. So let's move right ahead and move into our switch over to the next part, to part two. This is going to be the sponsor showcase, and as I said earlier, it's going to be, we're going to showcase or put the spotlight on Novo Nordisk and on Sanofi. Both are long-term supporters of Texas Business Group on Health and our educational programs. So with great appreciation, I'd like to introduce our account manager from Novo Nordisk. That would be Tom Zabaski, Senior Regional Account Manager, whose focus is on obesity, particularly in this region. So thank you, Tom, for bringing first of all, for bringing Dr. Hartenbaum to us. But I know that obesity is a key area of focus for Novo Nordisk, obviously, after today's presentation. But there are some other conditions, related conditions your company is working on, and what are you known for? And then tell us a little bit about that. And then I want to ask you about the types of resources you offer besides great educational program speakers like Dr. Hartenbaum. Tell us a little bit.
Well, thank you, Marianne, and thank you for the opportunity. And I'd like to thank the Texas Business Group on Health for organizing programs like this. And yes, Novo Nordisk has traditionally been in the diabetes market for a long period of time, but we realize that obesity is a much bigger problem. So we entered into the obesity market to assist employers most recently, and that's my area of focus.
Well, you certainly are doing a good job of starting out with a program like this, which we very much appreciate. Are there other resources that you offer? Usually when we have this in a live setting, we would have a room, our sponsors would have exhibit tables where they would showcase some of the valuable resources that are offered. Are there some other things that you might want to talk about a little bit about what else is offered?
Yes, well, thank you, Marianne. Great question. And actually, we do have a number of resources available. We do have something specifically designed for employees or patients. And that's a program called Truth About Weight. And as Dr. Hartenbaum mentioned, obesity is a very complex disease state. And part of this Truth About Weight is for employees to understand a little bit more about the science of weight loss. And then secondly, part of this program is really speaking to how do you start that conversation as a patient or employee with your healthcare professional, because that can be very difficult at times. So part of this Truth About Weight is to assist people with that conversation. Now, specifically for employers, you can see up on the screen, this is part of a program that we just rolled out. It's called The Way Forward. And it's actually a comprehensive program designed to assist in weight management for the appropriate employees within your organization. And there's actually 5 modules in this program. The first is just recognize the impact of obesity. Second is know your numbers, as Dr. Hartenbaum mentioned. Thirdly is act now, and it's kind of a step-by-step guide to managing weight as an employer. Next is honing in on your population or your employees that are at your highest risk of these complications. And then probably most importantly is how do you measure success and what does that look like? So those are 5 comprehensive modules that are available to employers. And if you want further information on that, please feel free to send me an email. And my initials are tmz@novonordisk.com. And my cell phone is 774-210-2226. And I think that's going to be sent out after the program. And Marianne, I would just like to thank you for the opportunity and thank you for what you do for employers in the Texas market. Thank you.
Well, we appreciate what you do as well, and thank you in return. We will put Tom's information on the slide, on the link. I wanted to remind you that we will be sending you a link to the recording to anyone who has registered for our series. We'll receive the recordings from all 4 sessions, whether or not you sit in for all 4. And the this particular slide will have Tom's contact information on for those who are interested. So our next spotlight is on Sanofi. Sanofi also is a long-term supporter of the Texas Business Group on Health and Dallas-Fort Worth Business Group on Health, and probably our other coalitions, San Antonio and Houston. So Sanofi is dedicated to supporting people through their health challenges. And it's a global company. They focus on vaccines, innovative treatments. You can read what I'm showing you on the slide. Our account manager is Russell Hanselman. He's provided this information about Sanofi and also about a valuable resource that they have been providing or producing for the Texas Business Group on Health since 2006. If you'll go to the next slide, Michelle, I just wanted to mention about the Texas Type 2 Diabetes Report. It's a powerful comparison of various aspects of type 2 diabetes in Texas and several Texas markets. It highlights financial information, utilization information, treatment information, and a host of other good, useful comparative data for type 2 diabetes in Austin, Dallas-Fort Worth, El Paso, Houston, Galveston area, Lubbock, and San Antonio, plus for the state as a whole, and compared to the national results for the cost of physician treatment, cost of inpatient hospital treatment as examples. So it's a great, valuable resource. I believe they're going to produce it again. It's an independent resource that does not use any Sanofi data whatsoever. It takes the data from the Managed Care Digest every year and puts it together. So when that's ready for 2021, or actually be for 2020 data, we'll get that out to all of our members. So thank you, Novo Nordisk and Sanofi, for your support. So this is an example page from one of the charts that's shown that compares the percentage of people who have type 2 diabetes and depression and hypertension and hyperlipidemia and obesity. So that's one example from the report. So let's move right into part 2 of our section 2 of our session. And this one focuses on the burden of obesity, but what are some of the innovative high-tech, high-touch approaches to managing obesity and its related chronic conditions in at-risk employee populations. And I'm really pleased to introduce CJ Mark. She is the Chief Commercial Officer for Vita. She's been in this business for 20 years, working in healthcare and employee benefits, and focuses on simplifying the access, lowering the costs, and improving health outcomes for a workforce. She formerly was with Teladoc and then was area president for Gallagher Benefit Services. She's very, very knowledgeable about this area, and we're excited that she's going to spend some time with us this afternoon. I'll go ahead and introduce Tara Sherman first before I introduce David, because Tara uses some of the Vita products, and she is the health and well-being strategy team with the Boeing Company. She works in the development of long-term strategy for both the U.S. employees and international employees. And she's responsible for the deployment of new programs. I imagine this one included, which you probably will talk about, and focuses on mental health, emotional well-being, healthy eating, leadership engagement, external recognition, and partnership with safety, global corporate citizenship, food services operations, and well-being, primarily well-being of their employees. So then I want to, so she and CJ will tag team on this. And then I'm so pleased to invite David Witt, who's the Employee Wellness Manager of the City of San Antonio. He has been managing the City of San Antonio's wellness benefits since 2014. And he oversees the design, implementation, and evaluation of all their health and wellness programming, and they have about 13,000 city employees. We'll talk with David a little bit about some of the ways that he's working with the City of San Antonio employees on managing obesity and other related chronic conditions. David also serves on the board of directors of the Texas Business Group on Health, and he has been a long-term member of the San Antonio Business Group on Health and in a real leadership role as well. So with that, let's start with CJ. We will have time for questions and answers afterwards, but go ahead and use the Q&A box below or at the bottom of your screen, and we'll address those at the end of this discussion. Thank you. So CJ, tell us about High Touch.
Big thank you, Marianne, to you and your team and the Texas Business Group on Health. And I hope your members are staying safe as the hurricane, in the middle of a hurricane. So really appreciate everybody joining us today. And as Marianne said, I've been in this virtual care space for quite a few years, was an early adopter. It actually embedded a telehealth capability into my disease management program in the early 2000s, which was called Being on the Bleeding Edge. So I'm extraordinarily passionate about the way virtual care can and is transforming healthcare delivery in our healthcare ecosystem overall. So we're going to talk a little bit today about what Boeing's doing specifically to tackle the physical and mental health capabilities. If you go to the next screen, I think there's a little picture of Tara and I, so hello again. If you go to the next screen, this is really talking about chronic disease, and you see this as employers every single day. I'll have Tara talk in a minute about what she's seeing specifically in the Boeing employee population, but we know in our healthcare system today that about 40% of adults are living with 2 or more chronic conditions. We see this in our VITA data today. On average, those folks on our platform that have a chronic condition have 3.3 co-occurring chronic conditions. So as Dr. Hartenbaum talked about obesity being one of those chronic conditions, absolutely, and the multifactorial approach, we'll talk about that and what Boeing is specifically doing around that. 68% of adults with a mental health condition have at least one other medical condition as well. So we see that across the VITA book of business as well, as 70% of our members that have a chronic condition also screen positive for depression. So think about that. You're already trying to tackle a chronic condition and you may not be able to get out of bed in the morning. And 48% of the folks on the VITA platform that have a chronic condition also screen positive for anxiety. So this whole thing that I think you're going to hear about co-occurring conditions, about tackling this being multifactorial, absolutely true. We see that today. And then we know that of those that have multiple chronic conditions, on average, they're costing 4 to 6 times more. And I'm sure you see this in your data on a regular basis. So I'm going to turn it over to Tara to talk a little bit about what she's seeing specifically in terms of co-occurring conditions inside the Boeing population. So Tara?
Thanks, CJ. Yeah, just for anyone that's not familiar with Boeing, we are about a $75 billion revenue company. We have 3 distinct business units, and our Boeing Global Services is actually based in Plano, Texas. So we have a strong Texas connection too. I would say our demographic skews a little bit male and probably mid to late 40s. When we talk about weight specifically, we see ourselves really mirroring the greater US. So about 1/3 of our employees are overweight, 1/3 obese, and about 1/3 are at a healthy weight. And as CJ was talking about the conditions having 2 or more chronic conditions or having a mental health condition along with a medical condition, we see that definitely in our population too. I'm guessing most of you also do. And so we think it's really important to help people manage their health, not in a silo, but manage these things together. When we look at our priorities at Boeing, we want to truly help our employees live their best quality of life that they can for themselves and their family. And when it comes to from a business need, we want to make sure that our employees are as productive as possible and that we're able to contribute to the bottom line. And that can come from strong ROI from programs like VITA, And like the doctor talked about a few minutes ago, we see those costs carry forward into future years when employees are able to address these conditions in a positive way.
Absolutely. Well, thank you, Tara. Tara, I can't talk today. That's the the mid-afternoon thing. So if we go to the next slide, Tara, I was hoping you could talk more specifically about how you're deploying this polychronic condition management approach inside Boeing. So, and how that's cascaded, and some of the tips that you have with regard to that.
Absolutely. Well, a couple things. I'll kind of cover this slide and then how we've introduced the program. I think that when we were looking for solutions, what really stood out to us, and I think as others look at digital solutions, is what's right for your population. We love this solution because of the breadth of programs that are presented. We think that's really important because employees don't always know exactly where to start, or it might not seem where we would say from a care path you would want to start. So maybe I'm not ready to lose weight, but I know I need to clean up my eating. Well, then there's a nutrition program. So programs like VITA that have the breadth can really help meet an employee where they're at to start making these steps. We love the connection of technology and a coach. I think that's really important too, that there is something that supports individuals, but also there's a real person on the other end. And that makes a real difference when we're talking about accountability and someone to understand and someone to help meet challenges. We've done a lot to really bring this program to life at Boeing. We've done some of your traditional communications that you would see in a site or on an intranet, but we've also had many VITA health coaches out at our sites. This is pre-March, how things have changed, but to really show people there's a human being behind this program. This isn't just an app. There's real people here to help you, to help support you, and see you through this. And we think that that's a big enhancement to helping people access the care that they need, and that's one of the items listed here. It's not always easy to get the care that you need, whether that was years ago going into a meeting, kind of a support group for weight, or even getting into your doctor on a regularly occurring basis. It can be really challenging. And so having healthcare in your pocket is something that is really useful for our employees, and we've really tried to capitalize on.
So, so very insightful. That reminds me of something that one of our providers recently said, Tara, when you talk about that kind of human touch and the robust technology. This provider actually literally said that combination of AI and machine learning really allows providers to have bionic capabilities. So, it's that combination, I think, that helps us to be able to really connect in a very human way, but it arms the providers so that they can be even more effective as they deploy those evidence-based clinical care protocols and programs. So if we go to the next slide, let's talk a little bit about this kind of cycle. And I think Dr. Hartenbaum touched on this as well, right? Which is, we know that there are folks in the population that may have depression, anxiety, stress. You touched on this before, Tara, unhealthy habits, the poor sleep, nutrition, low exercise levels. I just read a statistic that alcohol consumption went up 55% during COVID-19. I must confess I'm having wine more often with dinner right now myself. So if I continue on that path, right, that could lead to weight gain, and which is, leads to chronic conditions and kind of this reactive medicine-based care. And obviously, there's always a place for the pharmaceutical intervention as well as part of this whole continuum. But can you talk a little bit about how members can come in? I think you touched on that briefly, how members can come in depending upon where they are in this whole cycle. So whether it's anxiety or they're trying to tackle, and you talked about the nutrition piece. Can you talk a little bit about the mental health component of that as well?
I sure can. This was a huge draw for us too. I think that we all continue to fight the stigma that is associated with mental health, and I think as a society we've made a lot of progress. But it's still not always easy for people to get the help, and then we talk about getting access to care, whether it's getting to an appointment. Many therapy appointments are reoccurring, so sometimes that can be really difficult, or even finding a provider. And so we loved seeing that there was a mental health component and program offerings in VITA right alongside things like weight management and hypertension and other programs like that. For many individuals, I have a firm belief that stress is kind of like an entry into mental health support, because it's almost fashionable these days to say you're stressed. Everybody's stressed. I'm so stressed. I'm really stressed. I haven't been this stressed in a long time. It's not great, but it's very easy for people to say. And so sometimes it is just stress, and we can get some support early on and kind of limit it from growing. And sometimes it's more than stress, actually. Sometimes it might truly be anxiety, the way we're describing stress. And so the VITA onboarding process helps to get people into the right program, but never forced. So a program will be recommended, and employees have the option to take that recommendation or to seek another program. The other beautiful side to starting to address some of this mental health is someone may, let's say they get an anxiety program recommended, but they're not, at that point, they're not ready to go down that route yet. Maybe they sign up for weight management, but if the coach recognizes some behavioral health or mental health needs, they can invite in a specialist for a coaching session, or incorporate that in another way, so that employees are starting, with their permission, of course, to get some of that support, which we have seen bring so much more success to the movement people are working hard to make in weight, nutrition, physical activity, and some of those other areas.
Yeah, absolutely. I mean, it's interesting to hit on something you said. You know, as you talk about polychronic people in the population, and you have a predominantly male population, and you know, nothing against the males out there in the audience, but men tend to not, you know, even if they might have something, you know, happening from a mental health perspective, they don't tend to come in for a mental health condition, but they might, I think you touched on this, they might come in for poor sleep, and they can get referred then to a therapist to help them tackle depression or anxiety. And I like the way you touched on the ability to come in at a subclinical level for those anxiety and stress, and then maybe tackle something that is deeper in terms of depression that is actually clinical in nature as well. So that really resonated with me. I think if you go to the next slide, this really shows a lot of the data around this, right? So treating the body and mind together, in other words, the physical and the mental health together, this is true outcome data. Our clinicians obviously love this. And you can see that as you tackle the dots, which, you know, the metrics in terms of weight loss, the metric in terms of depression, that they're both declining together. So, can you talk a little bit about the data that you're seeing at Boeing around that as well? And as you see those co-occurring conditions, and you see the reductions as you tackle them both together.
Yeah, so we are seeing a really strong connection, and we are seeing our employees that have more than one chronic condition working with VITA. It's kind of like I touched on a little bit earlier. We're not really, as human beings, we're not a condition or a silo, and so it's really important to address these things together. And I think any of us in this meeting that have struggled with weight, I have over the past 10 years, it's not easy. And I think when we really stop to think about it and progress, as we've seen some of the research and evidence progress in the past years, it's not just a calories in and calories out. And there's many reasons why we eat or don't work out, or whatever other pieces may be involved. And we've really got to look at this whole person. We've got to start handling things together, because it's not easy, and we're complex beings. And so the support that we can give people from a mindfulness perspective or from a mental health perspective can really help start chipping away at some of those behaviors and take small steps to make improvements that then can lead to really fantastic outcomes. And we've seen and heard from some of our employees. That's been one of the most rewarding parts of my job, and probably many of you would agree, is when you introduce a program and you get to hear from employees that the program has changed their lives. And so it's always great to hear about the weight loss, but for me, it's been really, really meaningful to hear about the mental health pieces and people making that connection and making progress. So I think we can't underestimate that.
Absolutely. So if we go to the next slide very quickly, because I want to make sure we wrap this up and give David lots of time as well. This is really just talking about the trends in terms of demand for virtual care, even before COVID-19. So this was data from National Business Group on Health and the Bankrate Healthcare Survey, looking at the top initiatives. I know Dr. Hartenbaum touched on this as well. I will say that having been in this virtual care marketplace for lots and lots of years, I think about, Tara, where we were even 5 to 6 years ago when we were saying this person would never use virtual care, right? And how that's changed. It changed gradually, but I think it's changed overnight. So I'm sure you're seeing this today at Boeing as well, a higher adoption rate.
We are, yeah. I think COVID kind of forced all of our hands as users. I know I certainly have used more telehealth over the past few months, and I think it will be interesting to see how much stays. I think we'll probably have a little bit of variability before we stabilize, but I would expect to see us stabilizing over pre-COVID rates.
Absolutely. And if we go to the next slide, this again is just talking about the acceleration of virtual care adoption. 76% of consumers surveyed now are saying they're interested in using telehealth or some kind of virtual care. And if you go to the next slide, this is really talking specifically about the Boeing weight loss program and the outcomes that Boeing has seen. So Tara, if you could kind of address that, that would be fantastic.
Absolutely. So what we wanted to show you all here is the most meaningful outcomes. So anytime we have a digital program that's free for our employees and easy to access, we get a big take up, but we want to look at the ones that are truly committed. And so we have looked at that group by those that complete at least half of the coaching sessions. So it's roughly an every other week coaching session. And we've seen 5.5% weight loss of this group of over 100 employees. And as the doctor mentioned earlier, between 5 to 10% of weight loss means really statistically significant disease risk reduction. So we're really pleased with that. We think the coaches really make a difference and bring that accountability for our employees.
Absolutely. And if we go to the next slide, this is really talking about CBT program therapy and in reductions and meaningful reductions in depression and anxiety. So at baseline for members that have at least one consult or are sent 12 messages and who were enrolled for at least 8 months, we're seeing at baseline that 52% reported mild anxiety and 47.3% reported moderate to severe anxiety. And we saw 52.4% reduction in anxiety by program month 3. And they maintained that through the end of the program at month 9. And again, one of the reasons why I'm so passionate about virtual care access is this ability for the member really to engage. They don't have to have a therapy session every single week. If they want to have ongoing therapy sessions, they can do that. They can engage through text and messaging also with their provider on an ongoing basis. And at baseline, 59% reported mild depression and 41% reported moderate to severe depression. And we saw a 38.4% reduction in depression by program month 3, and they were maintaining that through month 9. So again, it's really about sustainable outcomes. If you talk with our clinicians as they design programs, one of the things that I would say that they came, before coming into virtual care, frustration in terms of brick and mortar is that members would cycle in and cycle out. In other words, they'd come in and do therapy, they'd cycle out, and they weren't actually seeing meaningful reductions long term. So this ability for members to really come in and out and have ongoing access, I think really makes a difference in terms of baseline. So do you want to talk a little bit about that, Tara? And then I'll kind of move things along here.
Yeah, so we actually just did an emotional well-being and mental health survey on our employees, and we did hear that that getting into care is challenging for people. So we're still working to kind of shift that I guess that traditional view that you do need to go in for care and move people along into some of the opportunity that exists in a virtual environment. They're able to do it at their frequency and have the support in between those meetings, which I think is also really important. When you bring in a digital tool, you not only have that CBT or your sessions with your therapist or coach, but you've got additional tools with you all the time, whether it's a thought tracker or some other tool. It's there with you in between those sessions. So you're starting to build up the tools that help yourself. And I think the really cool thing that I'd like to point out on this chart is we saw a spike in anxiety and depression, and we've noted that we think that's due to COVID. And then we also saw it drop again. So one thing I'd say is we're probably hard pressed for any of us to say that COVID didn't impact our mental health in some way, shape, or form. And so what's really meaningful here to me is our employees that were in this program, they had that uptick, just like many of us probably did, but then we're able to utilize the tools and resources available with them to stop that trajectory and be able to go back to a reduced level of anxiety or depression.
Absolutely. So I know that Marianne, we want to make sure we get to David. We've got, just a couple closing slides. If you want to go to the next slide, which is obviously we've been talking about every mental health condition being, impacted, impacts physical health. That's clear in the data. You saw that with Dr. Hartenbaum as well. And if you go to the next slide, as we talk about COVID specifically, I think we all know this intuitively or at a gut level. Virtual care will continue to improve. Hopefully we'll get a chance to talk about this in more detail as connected device information continues to improve, this ability to connect on the fly. This ability to be able to take analog to, Terry, you talked about this before, even take an analog device and upload that information into a digital environment for tracking so that it gives that bionic capability to providers so that they have that information on an ongoing basis. That quick access you talked about, the rapid and sustained clinical outcomes, absolutely critical. Consistently high engagement, that's been one of the, we've been talking about engagement for years. It's the bane of our world and employee benefits. And then obviously you want to make sure that we have sustained high member satisfaction. And I'll turn it over to Marianne to kind of kick it over to David.
Thank you very much, CJ and Tara, for a really interesting discussion. I was excited to see how that ties in with actually session one, where Mary Beth Gray talked about the technological advances that are being applied in healthcare. It's just we're in for a roller coaster ride of developments in new technologies and new applications, and this sounds like a good one. Very interesting story, and thanks for sharing about Boeing's experience with this too. It sounds like you have a good handle on things. But not every company is able to or has gone into that type of a high-tech, high-touch, personalized health or health management. But they do try other things. And David Witt with the City of San Antonio has done marvelous work with the city employee wellness programs. And David, if you'll tell us a little bit about that, and it may not be the latest and greatest high-touch AI applications and predictabilities, but I know that I've heard, and you've told me before about some of the really cool things you're doing.
Absolutely, absolutely. Well, you kind of hit the nail on the head, Marianne, in regard to some of that high tech stuff and it not really being applicable to a large number of our population. From a demographic perspective, we have approximately 13,000 employees that serve the seventh largest city in the United States. It's comprised of more than 1.5 million citizens. But with 38 different departments, obviously comes a wide variety in our population, much like the city that we serve. So we're talking from blue collar staff at our solid waste and public works and parks and rec departments to our brave first responders at San Antonio Police Departments and Fire Department, librarians to judges, building maintenance to pre-K teachers, and so many more. Each population is a sort of corporate community of itself. For a number of our employees, English isn't even their first language. A lot of our employees don't have access to the internet at work or home, much less know how to use those tools. And that creates an unfortunate digital divide among a large portion of our population. But in short, we're a very large employer with our employee demographic being all across the board, which certainly doesn't make our jobs any easier. But and from a health perspective, as you might imagine, we closely mirror that of our community as a whole. Obesity certainly has not forgotten about us, nor have the chronic conditions associated with obesity, including diabetes, hypertension, heart disease, sleep apnea, musculoskeletal issues, you name it. But we're in for the long haul. And so next slide, I wanted to just kind of share a photo of our team. And so there's three of us, myself and a senior analyst and an analyst that are employed by the city. And we also contract out 3 Blue Cross Blue Shield of Texas health coaches. And a very important part of what we do is treating those coaches not just as any other contract employee. They are truly a part of our team. They're part of our strategy. They sit at the table with us and come up with ideas. They share stories that they're seeing out in the trenches. So it's a very, very important part of what we do. Next slide. Really quickly, I wanted to talk about our program history. And you'll notice a few things as you look at this timeline about the growth of our program. I'm not going to talk about every single one of these, although I could go on and on and on about each of them. It would warrant their own presentation, but a few things of note I've highlighted here. Back in 2007, it was when we first established the wellness program, which marks the incoming of our city manager at the time, Cheryl Scully. And she made it a point to establish the wellness program and start addressing wellness among our employee population. One of the big things there was the city manager's 5K walk and run event, which is still going strong today. Started out with 300 people at one of our local parks and has now grown to over 3,500 participants. Now, of course, that was pre-COVID. This year, we're doing the event virtual, so we'll see how that goes. Should be interesting for sure, but that event is kind of our way of coming together to celebrate all of the efforts and the city's commitment to the well-being of its employees and their families. We started offering fitness center discounts around that same time as well, and then progressed to offering employee health kiosks where our employees are able to check their blood pressure, their weight, their BMI, and now they can even check their body fat percentage. Of course, lunch and learn sessions, which are, very standard part of most programs. But those lunch and learn sessions have grown throughout the years. We've started to address, much like our programs, as you'll see across this timeline, start to address more than just simple things like diet and exercise, although those will always remain foundational elements of health and well-being. We start to, develop things that focus on mental well-being, mindfulness, just thinking outside of the box. And so in 2011, 2012, we added our on-site health coaches that are still there today. We started also offering discounted diabetes medication, and often those medications are actually provided free of charge to help our folks manage their chronic conditions, namely diabetes. A big hallmark that happened in early 2013 was we started a relationship with Virgin Pulse, and we still offer that program for our employees today. essentially we put our money where our mouths were, and we started incentivizing folks when they, along their well-being journey. And so with the Virgin Pulse platform, we outfit every single one of our employees with a free pedometer to track their steps. And they can earn up to $500 a year in the form of an HSA or FSA contribution. Unfortunately, that's been put on hold for the next fiscal year due to COVID-related issues, but we are looking forward to that coming back, and the program will still be will still be offered despite the fact that there will not be an incentive tied to it. And then what you start to see around this time frame is that we started looking at creating a culture of well-being. And so one big part of that, you'll see highlighted there in 2013 or 14, was we added wellness to our directors' employee performance evaluations. And so every single year since, we have asked the directors of each of our 38 departments to write a memo and tell us how you have supported the health and well-being of your employees. And so what that does is that creates that top-down approach and makes even these directors know that we mean business. The health of our employees is incredibly important, so much so that it's tied into your pay increase every year. And so we every year sit down, a committee of us, and we grade those memos and we score them, and those scores are directly tied in part to their annual raises. We also started in 2017, we started working with the Livongo Diabetes program, which has been a huge success. And then we started really focusing at that time on branding and communication. So we created the COSA Well program and really kind of just took standard communication and marketing approaches to everything that we did. We felt it was very important not only to provide the tools and resources, but to communicate the importance of those tools and resources under a recognizable brand. And so I'm even wearing my COSA Well shirt right now, and you'll see that logo kind of appear everywhere, again, as part of our culture. And then even recently, we've worked with our Metro Health Department and created a healthy food and beverage procurement process. And so this is an administrative directive of the city, which means we mean business. And there's no more just ordering pizzas and burgers for meetings on site. You have to offer a healthy option, which we felt was incredibly important to at least offer something for folks. And so I won't get into all the details there, but in short, we are making sure that a healthy option is always available at work meetings and work parties and things of that nature. And then, of course, in the future, we've got some things coming down the road. We're moving to a new headquarters across the street, and we're really looking at changing the built environment. Now, San Antonio, many of you know, is kind of spread out. We're very geographically dispersed as an employer as well. We've got over 120 something locations, maybe more across the city, but at our headquarters, we want to change the environment and feel that all of the other locations will kind of follow suit with that. So we're looking at building a wellness center, an on-site wellness clinic, downtown walking trails, and a lot of different things that will help to change that built environment. But all of this, I want to go back to a point I was making earlier. It's incredibly important that we create a culture, right? And you hear that term all the time. But we offer a lot of components, and you could see that we offer a robust variety of resources to aid them throughout their wellness journeys, wherever they may be along that journey. But offering programs is only one piece of the puzzle, I feel. And so before your program can truly be effective, you must simultaneously and continuously be striving to migrate toward that culture that prioritizes well-being. And trust me, I know that talking about culture and creating a culture among 13,000 employees is two completely different things, right? But a culture shift does not happen overnight, and we have to kind of remember that as we're looking at data, and we might see some consistent increases in these chronic conditions We hope to flatten those and eventually reduce those, but without creating that culture first, we don't feel like that's really going to happen. And so for us, with 13,000 employees across 38 departments that each have their own individual cultures within them, we don't kid ourselves by thinking that we can truly understand and effectively address each and every subculture that exists among our population. It's just never going to happen. But this is where you go directly to the source, in my opinion. For us at the city, to help us, a major strategy that we use is our network of wellness ambassadors, or some employers like to call them wellness champions. These are the folks that are living within their individual worksite culture and who understand what specific barriers exist between their coworkers and their coworkers' progress towards a healthier version of themselves. And so, I encourage you to speak to your employees more than anything. Ask them what's working and what's not. Ask them what's missing and how you can improve your program. These are your people, and they're not going to change just because you tell them that they should. They need to want to change. We have to meet them where they are. And at the end of the day, we have to trust that they do want to make positive changes that improve their lives, both at work and at home. So even if it's on their own terms. So listen to them, provide them the tools and the resources that they need, of course, and allow them to help guide you as you make your workplace one that truly, truly embraces well-being.
David, thank you so very, very much. That you have a very comprehensive program and a great plan, a progressive plan. So it's quite impressive. There was one question about how you measure the ROI on the cost savings, other than all the other wonderful improvements that are happening.
That's a great question, Marianne.
The only question I have, so.
Well, and it's a good one, and it's one I've been hearing my entire career in this field, and it's not an easy question to answer, and I don't know if it really ever can be answered. What is ROI or VOI, value on investment? There's so many factors that Dr. Hartenbaum even touched on: presenteeism, absenteeism, and for an employer as large as us with so many different components and factors, not only in our wellness program, but our risk management department and other aspects of us as an employer, it's impossible, in my opinion, to truly come up with an ROI. We employed strategies to come up with ROIs. We hired a company called Benefit Science to help us determine an ROI, and it showed a 1.89% ROI, I think, at the time. But I don't put a lot of weight, no pun intended, into ROI, because at the end of the day, as an employer, we have a responsibility to take care of our employees. Does it really, really matter if we're getting back $2 for every dollar we spend, or maybe we're getting back nothing? Does that mean that it's still not important to provide these resources to our employees? Of course it doesn't. These are incredibly important benefits, that not only help with the health and well-being of our employees, but it also helps us as an employer attract new talent, retain talent, and all of those other components as well. And so, in short, we don't really focus on that anymore. We will look at things like engagement, enrollment. We look at data. I don't want to give the impression that we don't look at data. It's important. It helps guide your programming efforts, but my advice would be not to put too much weight into that. And now I know that, you may have a CEO or a CFO that's demanding an ROI, but you always hear in regards to wellness how important it is to have that top-down support. And we are very lucky at the city to have that top-down support from the mayor and council to the city manager, all the way down to our wellness program. And so, again, if they don't understand that, I would encourage you to do your best to try and help them understand, again, that we have a responsibility to help our employees more than an ROI.
I just couldn't have asked for a better response. Thank you very much, David.
Absolutely.
If we were live, we would all be clapping.
Yeah.
So, with that, this concludes our program. I'm sorry that it ran over just a tad, but I hope that you found it worthwhile as much as, I mean, I've copious notes already. So, but feel free to send us email questions if you have any on that. And I apologize that we didn't get through all of the questions that you may have had. So we're open to it, and we'll be happy to respond. Just a reminder that our next session number 3 will be next Wednesday at noon. And this actually is such a great tie-in, a 2-tiered strategy to support employee mental and emotional health during and beyond COVID. It ties in so well with what we learned today in today's session, and also in yesterday's session on the strategies for 2021 in the new normal. Anyway, so please join us tomorrow. I'm sorry, for next Wednesday and also next Thursday for the final discussion about emergent strategies to incorporate social determinants of health. All of these tie together. They're separate sessions, but the tie-in is just remarkable. So thank you so much, all of our speakers, CJ, Tara, David, and Dr. Hartenbaum, since she's left. We really, really appreciate your participation and your input. A reminder that on September 24th, we have part 1 of a cancer care symposium. You all should have received our first notice of that. They are 2 separate registrations. Part 2 will be with 3 workshops on prevention and early detection. Coordinated care is workshop 2, and survivorship and return to work is workshop number 3. That will be in the morning of October 15th. One registration is, once you register for one, you can entitled to go to all, but I think there are probably 2 ways to register for each one. More on that coming. Thank you again. We'll see you all next Wednesday, I hope. And in the meantime, have a wonderful weekend and stay safe, stay healthy, and stay engaged. Thank you.